What we're doing today is we're focusing on see how your gum tissues look.
Okay.
You wouldn't mind holding that for me? Have you seen this chart before?
I have not.
Okay, so what this is this is a progression of periodontal disease. So it shows us from the very healthy mouth all the way to what we call advanced periodontal disease. So if we're going through each one of these, when we're looking at a very healthy mouth, the gum tissues look really good. You can see they're nice and pink, they're not pulling away from your teeth at all. We have a little special ruler that we use, and it goes underneath the gum line, it's just 1 or 2 millimeters. When you look at bone loss, there's no bone loss. When we look at gingivitis, what happens is the gums start to get a little more red and puffy. You can kind of see the difference between those two. And sometimes you might see some tartar building up underneath here. That little ruler will go maybe 1 to 2 millimeters, and you might get some inflammation. When we get to periodontal disease, that's when you actually start to lose bone. You can kind of see the difference between those two. So what happens is that little ruler slides down there a little bit further now, 3 to 4 millimeters. Gum tissues are more red and inflamed. You can kind of see the teeth start to pull away from the gums. And you'll start to see some bone loss right in there. Once we get to what we call moderate periodontal disease, you've now lost more bone, so you can see it progresses down. Now it's going to be 4 to 6 millimeters. Gums are a little more red and puffy. You get some inflammation. You can see tartar building up. And now you can start to see more bone loss and also angular bone loss as well. When we get to advanced periodontal disease, that's when it's 6+ millimeters. You can see you almost lost half your bone. So what's going to start to happen is you start to lose teeth, things become looser, more inflammation. You can see right here, that's where all the bone loss is. So what we're going to do today is we're actually going to chart all of your teeth, and we're going to be charting 6 spots in each tooth. So what we're going to do is use my little ruler, and then we'll decide kind of where we are. So 1, 2, and 3 is what we'd like to hear. 4 is above with some bleeding or any type of bleeding is inflammation.
Okay.
Do you have any questions? No. Right. Let me set you back. Okay, so I'll set you back, and what we'll do is we'll chart from the upper right to the upper left. Let you rest, and then we'll check any bleeding spots. We'll check the upper left to the upper right on the inside, check for bleeding spots. Let you swallow. Lower right-hand side to lower left-hand side, check to see if there's any bleeding spots. The inside, lower left to lower right, and check for bleeding spots. Alright, then. So, you could hear all my numbers. You didn't know that there was going to be a little test at the end, but you have some really great areas in your mouth. You have a couple of spots that are 1s and 2s, and that's awesome. That's like what we like to see. But I wanted you to look at this together with me and kind of tell me where you think you might fall in this area.
Well, I guess since I have some 4s, probably right in here.
That is correct. That is very good. You do have some active infection in your bone. And as you can see, when we're looking at your chart here, there are some areas up in the upper right, the lower right, upper left, lower left. Those areas are all have some spots with bleeding. That's what the little red dots represent. So the problem is that you have infection in your bone. Okay? The consequence of not doing anything is what's going to happen is you're going to progress in disease. Okay? The great thing is I have a non-surgical solution for this. So what we are going to do is we are going to do some non-surgical periodontal therapy. Okay? And what that involves is what we're going to do is we're actually going to clean around these areas here so that we can get that infection out. So what we would do is all of the areas in there that have those bleeding areas and infection, we want to clean that out. So that's what we would do here. Right now you're really so lucky because you don't need any type of antibiotics. And sometimes when those 4s become 5s, that's when you need to have an antibiotic that's